everyone. This is Carla with NeedyMeds, and we're going to begin today's presentation. Thank you again to those of you that participated in the audio-visual check. And before I actually kick it off, let me just make sure our panelists can also hear me and that we can hear him. So Drew, if you're there, go ahead and give us a shout out.
Hello, everyone.
Fantastic. So thanks, everybody. We're going to get started. So today's special topic webinar is Creating Generation Zero, Resources for Prostate Cancer Patients and Survivors. My name is Carla. I'm the Director of Education at NeedyMeds. And I just want to go over a couple of housekeeping tips before we continue with the presentation. You can feel free to type any questions you may have into the question section of your GoToWebinar control panel. Just know that we'll reserve answering questions until the end. If we don't have the time to answer your personal question, we will follow up with you personally via email within about a day after the webinar. Also, this webinar is being recorded and will be available for viewing on our YouTube page, probably by the beginning of next week. So let's get started. For those of you who don't know who NeedyMeds is, here's a snapshot of our homepage. And I always put that up because really our website, along with our call center, are the faces of our organization. NeedyMeds is a national nonprofit dedicated to educating and empowering those seeking affordable health care. And we define education in two ways. One, by educating people about NeedyMeds and the resources we offer. And two, by letting them know about other invaluable resources and timely healthcare topics, which is why we are so pleased to have our guest here with us today. It is my pleasure to introduce our host, Drew Saelens, and I'm not saying that correctly again. It's Saelens, Drew?
Saelens. Yep,
Saelens.
You're there.
Saelens. For our audience, just so you know, every time I speak with Drew, he has to generously tell me again and again how to pronounce his name, even though it's pretty easy. It's simply Saelens. So let me start again. It is my pleasure to introduce our host, Drew Saelens. Drew is the Vice President of Government Affairs and Patient Advocacy at Zero, the End of Prostate Cancer. In this role, Drew leads Zero's fight for increased prostate cancer research funding, access to early detection and screening, and other public policies that help men and their families battle prostate cancer. Drew's background is in health policy and reimbursement consulting. He also secured funding to reduce patients' financial toxicity associated with high out-of-pocket requirements while leading the development team at the largest co-payment assistance foundation in the country. He holds a Bachelor of Science in Business Administration from the University of Richmond and a Master's of Business Administration and Government from the Johns Hopkins University. So you can see why we are so thrilled to have Drew and his expertise with us today. So without further ado, I'm going to go ahead and pass both the mic and our screen to our guest, Drew. So bear with us while we do that. You may hear a moment of silence. And let's see. Drew, you should be able to take it away. Thanks, everybody, and enjoy today's presentation.
Okay. Well, thank you again, Carlo. Zero is really happy to have this opportunity to present some information that will hopefully help those of you in the audience and those who will watch the recording later. So a little bit about Zero. First of all, we are a national nonprofit, and one of the ways in which we sorry, I had a malfunction here for a second. So we're a national nonprofit, and we were founded to advance research to help men and their families with prostate cancer, and specifically research at the Department of Defense. Our mission together is to create Generation Zero. So we want people's PSAs, their prostate-specific antigen levels, to go and stay at zero. We want there to be zero prostate cancer deaths. And hopefully someday with all cancers there'll be zero prostate cancer diagnoses. So we were founded as the National Prostate Cancer Coalition, and it was really a model that followed the National Breast Cancer Coalition. They had worked to secure some research funding at the Department of Defense a couple of years prior, and Zero came together with a lot of stakeholders at the time and decided to use the same model as the breast cancer community, and was able to bring a significant amount of research funding from the federal government to the Department of Defense. But we have evolved significantly since then, which we'll get into in the coming slides. So we are an accredited charity by the Better Business Bureau and a responsible steward of donor dollars. 84 cents on the dollar goes directly to patients and patient programming. And for several years, including 2017, we've been recognized by the Nonprofit Times as one of the best nonprofits to work for. And I certainly have enjoyed my time here, and it's really a pleasure to be able to work on behalf of men and their families every day. So prostate cancer is very common, although many men don't even know where their prostate is, much less what it does. There'll be 161,000 cases and almost 161,000 cases and almost 27,000 deaths. We're losing a man every 20 minutes, and that is always a rallying cry here amongst us that no time's to be wasted and no efforts to be wasted. There are men dying every 20 minutes, and we also have fought significantly for health disparities, specifically for men with a family history of prostate cancer and African Americans. I am not clinical by any means, but there's some interesting research going on about how African American men process inflammation and why that might be leading them to have an increased risk for prostate cancer. So some really interesting research going on there that hopefully can reduce the disparity between Caucasian mortality and African American mortality when it comes to prostate cancer death. There are nearly 3 million people living with prostate cancer right now in the US, and early detection and screening is one of the most important tenets of our public policy and awareness platforms, because if you catch it early before it metastasizes, there's a 100% 5-year survival rate. So that significantly drops if it's not caught early. And we'll talk a little bit later about some of the policies that have led men to not get tested, unfortunately. So 3 of our if you want to put big buckets around what we do, patient education and support programming, fundraising and awareness, and public policy and advocacy, and we'll get into each of those. So as far as patient support and education, our website is going to be your best resource. We have tons of dynamic content ranging from education about the disease to screening recommendations to resources for those who have been early diagnosed, all the way to survivorship and caregiver resources. So that zerocancer.org is going to be your best resource for education about the disease. And this Learn section in particular is where that information lives. You can see how many categories there are here and how deep it goes. The resource library is going to hold dynamic content that you can both watch and download and print. There's also a great section that has a lot of our previous webinars and videos that we've done with our medical advisory board and other patients. If you are looking to educate a loved one, or you're visiting your doctor or going to a health fair, there are fact sheets and literature that you can print out. These are great quick reads for anyone that wants to get high-level information. And then a really important tool is the questions for your doctor, because when you hear that you have a cancer diagnosis, a lot of people just shut down and just they are in their heads thinking about all the worst case scenarios, and so it helps to have a cue to help you understand, all right, here's what I need to know right now, and so you don't get lost in worrying and you don't hear the doctor and just the information goes by. So this is a really helpful sheet for you to bring with you when you visit the doctor's office. So a lot of support resources out on our website on that Learn section. NeedyMeds obviously does a lot of great work around helping people manage financial toxicity associated with every disease, and cancer is certainly one of those that really has a high cost to it to get the best treatment. So we have some resources here for you to understand where you might be able to get help with your prostate cancer out-of-pocket costs, as well as ancillary costs that may go with your diagnosis. And definitely, I've known about NeedyMeds for many years, and it's a fantastic website for this topic as well. So another feature of the website is a dynamic map that allows you to find a free testing center, and it is updated regularly as soon as people announce their free screening events. So definitely check that out and see if there's a free screening event near you. Another program that I want to get into in more depth will be our 0360 comprehensive patient support program. This is a case management program that can really help anyone knock down those financial barriers and insurance barriers, as well as raise their health literacy at the same time. So the webinars and videos that we talked about, we try to bring in experts from across the country, as well as our medical advisory board. We do one either a quarter or every 6 months. We try to definitely get one in, but really once a quarter is what we're shooting for. And you can see we've had them as broad as managing advanced prostate cancer, to bone health, because bones are where prostate cancer metastasizes the most, nutrition, managing cancer costs, survivorship, the genetic link, really interesting topic there. We had great turnout talking about how the BRCA gene can be linked to ovarian and breast cancer, and so it's really important for men to understand if they have that BRCA mutation, because their daughters could potentially be at higher risk, or sisters or other female loved ones. And then we had one about sequencing of chemotherapy and immunotherapy. And all of those, as I said before, are located on our website and archived for people to watch at their leisure. Here's a list of all the fact sheets and literature that I referenced earlier. So again, these are high-level, quickly digestible, great for printing out, that you can take with you. And you can see we also have some great brochures on prostate cancer at a high level, just getting yourself familiar with it, a little bit of different information for veterans, advanced prostate cancer, again, bone health, and really important to understand the clinical trials that are available in the clinical trials process. Clinical trials are often seen as a last resort, but in this day and age, with all the advancements and how quickly advancements are coming, sometimes you may want to consider a clinical trial earlier in your treatment. Definitely something to talk to your doctor about. Your doctor will probably not, because they're so busy, proactively reach out to you about clinical trials, so it's important that you advocate for yourself there. We also have community awareness toolkits that you can request online. You can see the URL at the bottom. These are great for if you're attending an event at your church or a community health fair, or if you are going to a VFW hall, but any sort of educational event in your community, it's great to request these, and we will send them out to you for free. And it contains educational material and talking points, as well as leave behinds and giveaways for the patients and families that. So please feel free to order those on our website, and we really appreciate the people who go out into the community and educate on the ground for us. So we talked about this free testing map. The URL again is at the bottom, zerocancer.org/test centers, and again it is dynamically updated all the time with the new free testing events. So be sure to check if you have trouble accessing PSA, prostate-specific antigen testing and screening in your community. Be sure to visit that website and see if there's a resource near you. So 0360 is our case management program that I wanted to dig into a little bit deeper. We did a survey of over 1,100 prostate cancer patients about what they wish they had or what they needed during their prostate cancer journey. And case management and advocacy rose to the top as a need that they wish that they had while they were going through their fight against prostate cancer. And it is really a comprehensive program. So it'll help with insurance navigation. It'll help reduce financial toxicity by trying to find help with out-of-pocket costs or ancillary costs that may come. It'll help negotiate utility shutoffs if someone is falling behind on their utilities or their mortgage because of the cost of their cancer treatment. It will help negotiate with those entities to try to get some relief during treatment. It'll also help enroll people in appropriate benefit and entitlement programs. A lot of people don't know about some of the government programs that are available to them. This includes Medicare and Medicaid, obviously, but it also includes programs like the Medicare Savings Program. It includes the Low Income Subsidy Program under Medicare Part D, Medigap, which is sold by private insurers for medical benefit under Medicare Part B, is often another option that will help people with high out-of-pocket costs. So a lot of help there finding the correct programs that people are entitled to that they may not be aware of, and getting them enrolled in those. And that goes beyond healthcare. We'll talk about a case study that demonstrates that in a minute. And then they can also help you find emotional support for caregivers or patients or family members in your local area. So the demographic of the people that we've been able to serve so far has been encouraging. 69% of the people that have come to us are looking for some sort of financial assistance. So usually that's the entryway and the gateway to how they find us. And there's often issues underlying those financial restraints that brought them to us in the first place. And so we can help them solve those underlying issues, which will then help alleviate the financial stresses that they're feeling with their cancer care. The case managers, like I said, this isn't just a one-time call. This is a really comprehensive program. So on average, they are taking 19 actions per patient. And so obviously that includes talking to the patient, but it includes talking to their insurance company or an entitlement program or negotiating medical debt, what have you. But they are really working a case on behalf of the patient. You can see an average age of 55 years old. 45% of the men that come to us have stage 4 prostate cancer, so they really need help ensuring that they can put all their energy into treatment and recovery, and less energy in some of the ancillary issues that pop up with a cancer diagnosis. And then 60% of the men who have come to us have a household income of $35,000 or less, and so we are happy that we're able to help people who may not have a high income at this moment while they're going through cancer treatment. We really are glad that it's being utilized by a population who can benefit from some of those entitlement programs and relief programs that we're able to point them to. So just a case study that it's anecdotal to the larger stats that we just looked at. A 56-year-old man came to us. He had been diagnosed recently with stage 4 metastatic prostate cancer. He thought he had Medicaid coverage at the time. He had lost his job and had to move in with his daughter. And he had unpaid bills, medical bills, and obviously no income and little to no savings. So really the cancer diagnosis was the straw that broke the camel's back. He needed help applying for the Social Security Disability Income Program and also for nutrition assistance. So the case manager coordinated a call with the Social Security Administration to verify Medicaid coverage and enroll the patient in the Social Security Disability Income Program. They were on hold at various times with the caseworker for over 2 hours. And as you know, when dealing with government bureaucracy, sometimes that can be a truth that it's really inefficient. And when you're going through a cancer diagnosis and treatment, you really don't want to be spending your time dealing with that bureaucracy. So the case manager for our program helps prepare and educate the patient on, here are the documents you need, here's what they're going to ask for, make sure you're ready, because when they do take our case, we want to make sure that we're not sent into the back of the queue because we're not ready. So eventually they had to go online and complete the application because the Social Security Administration office was just too slow and not helpful. Once the patient did that online application, they were successful in getting in Social Security Disability Income, which automatically qualified them for Medicaid. That retroactive coverage helped pay for unpaid medical bills and relieve some of that stress. The case manager also explained the process to get reimbursement from the hospital. So which forms do you need? What address do you need to send it to? Which billing codes do you need to put on? All that stuff is, as you all probably know, very complicated and can be in the weeds. And so the case manager walked this man through all those steps to make sure he could get reimbursement. And an ancillary effect of going through this process is the man had comorbidities, right? So he was taking 12 other medications, not for prostate cancer necessarily, but he was already taking 12 medications and paying out of pocket for them. And so when he got enrolled in Medicaid automatically through SSDI, he was then able to get out-of-pocket help through Medicaid for those other 12 medicines. He unfortunately was hospitalized, but the case manager kept working the case and stayed in contact with him in the hospital and was able to get him a nutrition assistance application expedited while he was in the hospital. So that is our 0360 comprehensive case management program. If you need help, I encourage you to visit our website and sign up for that program if someone you know needs help. If you are a social worker at a facility, I hope you'll take this information down and refer any patients to it that may benefit. I want to talk quickly about a new program that we have just partnered with an organization on. It's called Decode Your Prostate Cancer. And what it is it's a program that gives the patient and their oncologist a molecular profile of their actual tumor. So it'll take their tumor tissue and they'll do a complete analysis of it with proteomics and osteomics and multiomics and genomics, and really get, like the name says, it'll really decode your prostate cancer for you as an individual. And after they do that, they will run your specific profile through an algorithm, and that algorithm will produce a report that's reviewed by an advisory board of medical oncologists, and the report will go to you and your oncologist or you and your urologist, and it'll show a ranking of, based on your molecular profile, the top drugs, drug combinations, clinical trials, off-label drugs that would help somebody, that the literature says help somebody with your specific molecular profile. So it's a really exciting program. Right now, it works best for men who have metastatic prostate cancer and have had a tissue sample from the metastatic site and whose biopsy tissue is less than or equal to 2 years old. But it can sort of be a fast track, hopefully, to understanding which therapies work best or which clinical trials are showing the most promise for someone with your particular molecular profile, instead of, trying this and trying that. And as I said earlier, your physician is way too busy to understand all the different clinical trials going on the FDA.gov site or just in general. And so this is a way to be an advocate for yourself and try to shortcut that process by understanding your specific molecular profile. So transitioning out of the patient support and education, Zero also has a national RunWalk program. We have over 40 events nationwide, and we partner with urology practices in different cities to spread awareness and raise funds for the work that we do here and the patient programs that we just talked about. But also, it raises money for local organizations, the boots on the ground, if you will, in the different communities and cities that we have the RunWalks in. And we're proud to say that since 2008, we've given grants in the amount of over $10 million to those local organizations. And those local partnerships are invaluable because they know the communities and they know the best ways and optimal ways to spend money in those communities and meet those communities' needs. So it's been a really successful model, and you can go on our website and see if there's a RunWalk near you that you'd like to participate in. We also have a endurance athlete team called Team Zero, and these people, as you can see in the picture here, they do Ironman competitions, marathons. I'm actually running in, I guess, a week from Sunday with Team Zero in the Marine Corps Marathon in Washington, D.C. But it's another way that we bring awareness at these big Ironman events, especially to prostate cancer, as well as raise funds for the organization to support patients and research and advocacy. So that's a good transition into our advocacy efforts. As Carl said, I'm the Vice President of Government Affairs and Patient Advocacy, and so this is really my sweet spot. We are in a fight right now to protect some funding that is at the Department of Defense. There's $90 million in research funding at the Department of Defense, and it goes to academic research institutions all throughout the country to do innovative research on prostate cancer. And it is complementary to what goes on at NIH, except that there's some great differences that are important and why we want to protect this program. NIH uses kind of an academic scoring system that the best scored proposals that come in are funded from 1 to 100 or whatever it is. And it doesn't matter if all of those are, let's say, ovarian cancer tumors. Maybe all 100 just happen to be the best research proposals, but they're all for that one tumor. The program that we're trying to protect, it identifies strategic holes in over 30 different disease states, including prostate cancer. And it ranks the research proposals that come in on how the research fills those strategic holes. And so it's very different from what goes on at NIH, and it is complementary. And actually, the last 3 drugs for advanced prostate cancer can be linked to research that was done through the prostate cancer research program that gives out grants through the Department of Defense. So right now, that program is under threat. We are asking people to call and write their senators and congressmen to try to ensure that that program doesn't go away. And again, it's not just for prostate cancer, but over 30 disease states, which includes breast cancer, ovarian cancer, lung cancer, Alzheimer's disease, ALS. There's more information in depth on our website if you're interested, and you can certainly contact me. I'll have my information at the end of this. But that is our major policy issue, is ensuring that that program is protected and that it grows at a pace consistent with medical inflation, so we can hopefully get to some more breakthroughs and hopefully one day a cure here. We also have early detection and screening as a major tenet of our public policy platform. There's been a lot of controversy around prostate cancer screening, and we have worked closely with the American Urological Association as well as the large urology group practice association, Men's Health Network, and others to advocate for screening policies, especially for men that are at higher risk, as we mentioned, African Americans and men with a family history. We also generally participate with other coalitions on access to care issues that may affect men. I actually will be running to a meeting after this at Representative Rowe's office, who's the chairman of the Veterans Affairs Committee, to talk about some prostate cancer issues at the Department of Defense. I'm sorry, at the Veterans Affairs facilities, which you may have seen in the news over the past couple months. So really, these policy issues are really important to the community, really important to men who don't even know that they have cancer, or men that haven't even developed cancer, because we're talking about research and early detection. So again, we're fighting for that generation zero. We're fighting for men who have the disease right now, but also the future. And one of the best things that I've been able to do in my career is preside over the Zero Prostate Cancer Summit, which was my first one last year, and we're gearing up for a new one in February. It's been going on since 1998. There's an educational and training component, as well as an advocate interaction component. And then the third day of the summit, it's about a 2.5-day summit. All the advocates go up to Capitol Hill, they meet with their senators and congressmen, and they talk to their representatives about the issues that we just covered. Last year was a really exciting year. For the first time in 11 years, we were able to get an increase to that prostate cancer research program at the Department of Defense, which was a $10 million increase, and that can lead to between 10 and 40 different research projects, depending on how much research is funding per project. So really exciting, a lot of fun. Get to meet and interact with these guys that we talk to over email and Facebook and on the phone. They're all there, for 3 days, and it's just a lot of fun to meet with those caregivers and patients and families. So if you're interested in that, again, you can contact me at the end of the presentation. I'll have my email, and also you can go on our website, and there's a way to contact my associate who can give you more information about our summit. It is this year. It's February 25th through 27th, and it is in Arlington, Virginia, just outside of Washington, D.C. Like I said, it's just a really great event. 120 advocates came. Almost half of those were returning advocates, but we also brought a bunch of new people into the fold, which was really exciting to mix the veterans and some people who are newly fighting for the disease. A little over half were caretakers or family members, which is a really interesting mix with the patients, and it can get obviously very emotional. And you can see the male to female breakdown is almost even as well. Women are just absolutely vital to advocacy and grassroots, not only on Capitol Hill, but in the home. Women are definitely the catalyst for most men to go to the doctor, to get screened, to take care of themselves, to enroll in a clinical trial. So we're really happy to have caretakers and daughters and mothers and sisters and everybody who comes out to the summit is so fantastic, and it's a wonderful time. You can see that we had people from all over the country in all different cities, 37 states represented last year. It's just great to get all these people together and sharing their stories and going up to Capitol Hill and talking to their representatives. So another issue that we touched upon briefly a little bit ago is this controversy over early detection and screening. So the United States Preventive Services Task Force is a volunteer advisory body that pontificates on screening recommendations for I want to say about 50 different diseases and conditions, and one of those is prostate cancer. From 2008 to 2016, they were actually recommending to not get a PSA screening, which is just a blood test. And the reason they were saying not to do that is because they believe that the false positive rate of a PSA test is too high, and the potential negative effects of a biopsy, like infection, or again a false positive on the biopsy, were too great. And so they said the benefits of the harms of a PSA test outweigh the benefits. Don't get it at all. And some literature supposes that since this recommendation came out against PSA testing, the incidence of metastatic prostate cancer has gone up. And again, to go back to one of our first slides, if you catch it early, the 5-year survival rate is 100%. But if it metastasizes, those odds go way down. And so the other issue is that there's no symptoms, right? And so you're symptom-free until it metastasizes, and then you might start having some symptoms, but it's really too late at that point. So this screening recommendation has had an adverse effect. Last April 2017, the USPSTF revised its position in draft form to a C rating, which really conveniently sort of translates to see your doctor and have a conversation about whether it's right for you and your individual circumstances. And they recommended this for people 55 to 69. They did not have enough data to make a separate recommendation for African Americans or men with a family history, and we're hoping that by the next go-round of their review that we'll have enough data to make a separate recommendation for high-risk groups. But this recommendation has not been finalized yet. It's been, since April 2017, so, when we get into the new year, we're going to be closing down on a year very quickly, but I'm not sure when they will finalize it. They said it could take up to a year, but the problem is that between 2008 and 2016, you have an entire medical school classes as well as physicians, primary care physicians who have been told don't screen. And so it's their habit and their practice, many of them, to not screen men for prostate cancer. So even if this change occurs, it will take us some time to get physicians and primary care physicians educated and re-educated so that they do make screening for prostate cancer part of their routine care. So it's definitely a real problem and something that Zero will continue to fight for. We're working on a piece of legislation with the groups that I mentioned before, the American Urological Association and Large Urology Group Practice Association and Men's Health Network, on trying to get a urologist or medical oncologist as part of the review committee for prostate cancer. And actually it would apply to specialists of all the disease that they review. So sorry I got into the weeds a little bit about that, but really passionate about this issue. And it's just a blood test, so we really believe that men should be able to know their PSA number and then make a decision from there. So some contacts for the programs that we've gone over. You know, you can reach me at drew@zerocancer.org if you have any questions about the Decode Your Prostate Cancer, really 0360 as well, Decode Your Prostate Cancer, and anything about the advocacy or the summit. Happy to talk to anybody about that, or feel free to refer people my way. General questions, you can visit the website, zerocancer.org, or utilize any of the phone numbers that are listed below there. So with that, if there are any questions, I'm happy to take them, but thanks everybody for your time and caring about this issue.
Drew, thank you so much for that very thorough, timely, and important description, not only of what's happening at Zero, the End of Prostate Cancer, and the breadth of the work you do, but I think also the advocacy about what men and their families can be doing to speak up for themselves and get the care that they need. Are you having difficulty hearing me at all, Drew?
No, I hear you loud and clear.
Fantastic. Just checking, everybody. I had a little bit of audio problems on my end, but it was only my end, which I'm glad to report. Drew, if you want to go ahead and pass the screen back to me, that would be great. I will encourage people to, again, go ahead and take a moment to submit submit questions, thinking of two things at once. One of them is, please go ahead and submit your questions in the questions section of your GoToWebinar control panel. And the second one is just to let you know that after the webinar this afternoon, by the latest tomorrow morning, I would be happy to send everybody copies of our PowerPoint presentations. And before we go ahead and pass the questions to Drew, I also want to remind everybody that NeedyMeds is also here to assist with healthcare expenses. A lot of times when people are diagnosed, and Drew, you use the word comorbidity diagnoses, a lot of times when people have health issues, they don't have those issues in a vacuum. They have other healthcare needs that they're trying to afford, along with the healthcare needs of their partners and families and loved ones. So I just want to remind everybody that NeedyMeds is a source of information to connect you with resources that will help you afford all of your healthcare needs, certainly including medication, but not limited to medication. One of the ways we do that is through a robust database of prescription assistance programs, which are programs that are supported by pharmaceutical companies that offer free name brand meds to those who qualify. Also, particularly important to this webinar, all of the resources for NeedyMeds you can find under the Patient Savings tab of our website. You can, of course, always reach out to our counselors on our toll-free helpline, and all of this contact information will be at the end of today's presentation. But I did want to point out something called diagnosis-based assistance programs, which are programs, again, under the Patient Savings tab, where you can find assistance paying for healthcare needs related to a particular diagnosis, such as prostate cancer. We also have an entire section dedicated to coupons and rebates. And of course, if for some reason you find yourself in a situation where your healthcare insurance isn't covering your needs, and then you call NeedyMeds and we can't find a program that will help you, or we can't find another organization to refer you to. Our last straw is the NeedyMeds drug discount card, which you can use anytime without insurance to help save on prescription medications at your pharmacy. So with that, I'm going to go ahead, and one of the things I wanted to leave up while I asked Drew some questions is just to let everybody know some of our upcoming webinars later in the month. As you can see, we have 2 focused on specific diagnoses such as Raynaud's phenomenon and breast cancer later in the month. But for those of you interested in learning more about NeedyMeds, please join us for the upcoming overview webinar. If you can't make that one, we will just know that you can check out our webinars page or our calendar of events on the bottom right hand of our homepage to sign up for any of our upcoming monthly overview webinars. We do those once a month, at least once a month. So with that, I'm going to go ahead and ask Drew some questions that are coming in. One of the things is, can you just go over really quickly, because this was addressed, what should be the process when somebody's interested in getting screened for prostate cancer? How do they go about doing that?
Yeah, so again, it's really important to be an advocate for yourself, because your primary care physician and potentially even your urologist, if you are going to them for another reason, won't offer the screening potentially. So Zero follows the NCCN guidelines, which basically say if you are in a high-risk group, so African American or a man with a family history, make sure to talk to your doctor about getting screened for prostate cancer, and it's called the prostate-specific antigen test. For everyone else, the NCCN guidelines say that at 45, you should probably get a baseline, and then based on the number that comes back from your PSA, talk to your doctor about the interval at which you should get screened from then on. But again, it's about advocating for yourself and advocating for your health. Talking to your family, if you have brothers and your father, and make sure that you know whether they had prostate cancer or not, so that you know if you have a family history.
Thank you, Drew. Another question that we have coming in, we're talking about the PSA test, and you also mentioned earlier that there certainly can be false positives. You talked about why this was originally discouraged, this test. Now, and I'm going to stress, as Drew had said, certainly myself and neither Drew are clinicians, so we can certainly provide information, but always stressing that you should talk to your primary care or specialist regarding your specific situation. But Drew, we have a question about, let's say somebody actually has, does this happen regularly, and I don't know if you know this, if this should just be directed to a clinician. If somebody has a PSA test, and it comes out normal, and it turns out that it wasn't caught, their prostate cancer wasn't caught, and they wound up actually being diagnosed at a later time with prostate cancer. With that in mind, are there any additional tests to detect prostate cancer?
Well, so I think the question points to the importance of being screened regularly. So
okay.
One thing is, it sounds like the person who asked the question, might have had a low number at the initial screening and then didn't get follow-up screenings. But you definitely want to continue to get screened throughout your life after that first screening. As far as additional tests, there's a lot of different technologies and that are coming out right now, and I'm actually not familiar with all the different insurance coverage and requirements for those. Mm-hmm. My guess, without looking at the different coverage, is that you probably do need to have a PSA test in order to get insurance coverage for some of these advanced liquid biopsies and genomic tests and risk evaluation tests that are out there. But again, those are tests that you want to advocate for if you do have a high PSA number. Talk to your doctor about, okay, well, what tests are out there to determine the aggressiveness of my cancer and the risk of cancer. And I know there's one out there that you can get if you do have a family history. You can get sort of a risk score around your risk of developing prostate cancer if you have a family history. So again, be an advocate for yourself and get your PSA test regularly.
That's really helpful. Thank you for that thorough explanation. And thank you also, Drew, for being so vocal about the limits of health insurance coverage and making sure that people check with their doctor first and then their insurance coverage. I know oftentimes in my own life, and this happens to everybody that's listening to this webinar, people will give advice that may not translate into the real world because it's simply not affordable. So I think what you're saying is really important advice, that make sure whatever steps you need to go through, do your best to go through those, but keep that open conversation with your doctor and find out what this is going to cost you, your insurance company, and how to get them to cover it. As Drew said, advocacy is crucially important. We have one final question coming in, which is, are there support groups for patients and survivors offered through Zero?
So it's not our specialty. There is a group called Us2 International that has support groups around the country. There's some of those grants that I talked about earlier from our RunWalk fund, independent support groups around the country as well. And so there are resources out there. We do have the ability to, if you're interested in talking to someone about your specific situation, connect you with men who have volunteered to be what we call mentors. And basically what we'd be trying to do is, if you were, say, early stage localized prostate cancer and you were trying to decide between a prostatectomy and radiation, we could put you in touch with somebody who had gone through that exact situation, and or two people, you know, one who'd had a prostatectomy and one who'd had radiation, and you could have a candid and private conversation with them about their experience. Or, you know, if you're African American whose, you know, father died of prostate cancer, but you're not getting great treatment at your facility, you know, talk to somebody about how to advocate for yourself. Or if you did have a prostatectomy and you have erectile dysfunction and urinary continence, talk to another man about, hey, how does this affect your social life? How did you deal with it? What strategies did you use, you know, to mitigate those side effects of the prostatectomy? So we can hook you up with sort of one-on-one, peer-to-peer conversations. But as I said, there are some great support resources for prostate cancer out there as well.
Thank you so much. And Drew, if you can see this last slide of my PowerPoint presentation, the connecting people to those mentors, as you said, can they just call that 888 number right there that's listed on the first number, or actually the second phone number on that PowerPoint slide? Does that look accurate?
Yeah, that would be fine. And also please feel free to reach out to me at drew@zerocancer.org, and we can I can quarterback that and try to get you connected to somebody.
Fantastic. So if anybody has any additional questions, if any of the audience is like me and the question comes to you about 5 minutes after the webinar has ended, please go ahead and reach out to Drew at Zero, the End of Prostate Cancer, or certainly don't hesitate to call one of our expert counselors at NeedyMeds. With that, we're going to go ahead and wrap up today's webinar. And before we do that, we're going to thank you, Drew, for taking time out of your schedule to share your expertise with the NeedyMeds audience, and certainly wish you the best of luck running in the DC Marathon coming up, you said, in about a week?
Yeah, a little over a week. Thanks very much. I'm going to need a little luck.
Well, good luck to you, and everybody. We're hoping to coax Drew back into coming to another webinar at some point, so you'll find that on our website. And as I said, we'll do our best to convert this webinar into a video and get it up and running on the NeedyMeds YouTube page. I will follow up with everybody again to provide you copies with today's PowerPoint presentation. Thanks, everybody, for your time, and Drew, thanks again for sharing your expertise. Have a wonderful afternoon, everyone. Thank you.